I chose my specialty of neurointervention because of my interest in the brain and specifically diseases of the vascular system of the brain and the spinal cord. When I was a resident and a fellow, I was able to see firsthand how amazing the recovery in some of these patients were after we did some of our procedures. This is a new field and there's plenty of exciting opportunities in the future. My favorite thing about practicing medicine is that you fulfill so many roles. You wake up in the morning or in the middle of the night and you go in and you are seeing the patient and their families on arguably the worst day of their lives. By performing your role as a physician, what you are able to do is help them on these terrible days and also perform a service to society in making sure that our patients improve. My practice philosophy is to ensure that you get back to the level of function you were at before you came in and saw me. Many of my patients do come in with strokes and other cerebral vascular risk factors that prevent them from living their most optimal life. So what I would like to do is get them back to doing whatever they enjoy doing. My patient base are patients who are a little bit older and who unfortunately have vascular risk factors, including high blood pressure, high cholesterol, and diabetes. These risk factors do lead to diseases of the brain, including stroke, mini strokes, brain aneurysms, and arteriovenous malformations that we are able to treat in our practice. As a neurointerventionalist and stroke specialist, unfortunately many of the patients I do see are older patients who have some type of pre-existing disability and have a lot of vascular risk factors. So patients I will end up seeing in my clinic and ultimately treating are patients with carotid disease, strokes, brain aneurysms, arteriovenous malformations, and disorders of the spinal cord involving their blood vessels. My hope is we can identify the risk factors early so we do not have to treat these patients in an emergency fashion.